Hello, everyone. I have a question for you. Do you know what is the impact of adult day programs? Well, to answer that, I am Amrit Das, a student of gerontology interprofessional practice, and I, with my groupmates, conducted a research to try and find the answer for this. Well, the question of our research was, what is the impact of adult day program on seniors and adults with disabilities and their caregivers who used adult day programs? Well, it is important to find out about the effectiveness of adult day program because um, there are so many different type of facilities like long-term care, retirement homes, and hospitals, but the major problem is that they have less number of beds, and most of the people have to live in the community on their own. And the adult day programs have been found to provide services to these kind of people and make them independent. So we thought of finding out the effectiveness and the impact of adult day program for them. So the method that we used was a cross-sectional study. We sent Survey Monkey and questionnaires to 22 adult day program facilities in Southwest Ontario. The participants were seniors, adults with disabilities, their caregivers. We received 5 results till now and still are to come. Well, a literature review was conducted in which it was found that self-respect and dignity was enhanced by the participants who were participating in the adult day program. It also reduced the caregiver stress as they provided respite services. The atmosphere provided in the adult day program encourages general well-being and allowing older people to maintain their independence and allows them to live in their homes for more time. It also delays the institutionalization. So let's come to the results. So 60% of the current caregivers responded for the survey, and 20% of them were former adult day program participants, and 20% of them were current participants. They strongly agreed to the questions which asked about their satisfaction level. And they also said that they strongly agree that the adult day program helped them to build in the connections, reduce caregiver stress, has a positive impact on their whole well-being, physical, emotional, and mental, and lowering the feeling of loneliness as they can connect to other people. Most of the people went to adult day programs by community transportation, and the adult day program staff was qualified enough and was resourceful enough to help them arrange their transportation. 60% of the participants agreed to do the interview, which will be conducted by the next cohort of GIP students who will be doing a more extensive research about the qualitative part. So in conclusion, we found that the citizens who were taking part in adult day program had a good social well-being, emotionally healthy. They were able to detect health problems and had effective treatments in the beginning. For the caregivers, they could take break and had peace and satisfaction of mind. Apart from that, the healthcare system can also be taking advantage of adult day program that is due to the delayed institutionalization and reduced healthcare cost. Due to the certain limitations such as shortage of time, sample bias, there are some recommendations to make. For example, next time we can use a more randomized technique to select the sample. Also, we can check the qualitative part by doing face-to-face interaction with them so that they can be clear and they can give rich data about it. Thank you.